Today I'd like to share with you some tips and tricks when doing male catheterization. The first tip I want to talk to you about is maybe you're carrying a lot of weight in your belly and you can't really get a good hold of your penis to do your self-catheterization. I've got a really good trick, because sometimes what happens is the penis actually retracts and that you have a hard time finding it. So if you take your hand and put it where your pelvic bone is, you're going to push in, and there's like a fat pad there. You're going to push in and the penis will protrude, and you will be able to get a hold of the penis and hold it by the shaft below the glands. This is a really easy way of doing catheterization, because you don't want to try to do a catheterization by holding the end of the penis. If you have a large prostate, you may have trouble passing the normal catheter. You may need to use a firmer catheter. There's lots of catheters out on the market, so you might have to experiment. Sometimes a larger catheter will slide nicely in. Sometimes you need to use a bigger catheter. Although you might think a small one would make more sense, oftentimes using a bigger catheter, it can get nicely around that obstruction. If that's unsuccessful, you can always try the Coude catheter. And what the Coude catheter is like a straight catheter, but at the end that you're going to put in, there is a little tiny bend. And that little tiny bend will allow you to get in around the prostate. It's really important when you're using a Coude catheter to make sure you use it properly, so you need good instruction. The companies that make Coude catheters often will give you a guide that goes along the end, so as you're inserting the catheter with the tip up, you can make sure that the catheter doesn't turn on the way in. The next trick I'm going to share with you is passing a catheter if you have a stricture. What is a stricture? A stricture is a narrowing in the pathway, and that narrowing can be caused from many things. It can be caused from previous surgery. It can be caused from trauma. If you have a stricture, you need to get around that area. And again, how are you going to do that? Again, you can try a catheter that's a little bit firmer. You can play with the size, either try a catheter that's a little bit smaller or one size larger. And again, the Coude catheter with the little tip on it often can get around that stricture. If that's not working, another good option is to use the internal cathegel. And the reason that helps is when you put in the gel into the urethra, it opens the urethra, so it makes sliding in the catheter a lot easier. And if you have an anesthetic component to the gel, it numbs the passageway and makes catheterization so much easier. So I hope you found these tips and tricks helpful for your male catheterization.